Hello all, welcome back to Virtual Medical Educators platform. My name is Krishna Naineni. I'm a general practitioner in UK. I'm also a medical educator, a member of International Listening Association and an ECHO certified listening practitioner. Today, I'm going to talk about creative medical consultation skills. First, I'm going to take you through what my perspective of medical consultation is. Then I'll talk to you about the communication equation and the significance of listening in medical consultation. Next, I'm going to share some evidence-based listening tips for conducting efficient, accurate, and effective medical consultation. Last but not least, I'm going to introduce the new concept of listenability. First, what is medical consultation? There are various definitions about what medical consultation is, and there are various well-written books out there in the market that will tell you about what medical consultation is. But my perspective is medical consultation is a professional meeting in a psychologically safe and confidential space in which a clinician and a patient work collaboratively to establish a diagnosis and design a best management plan. The reason why I define medical consultation this way is it embodies all the key components. It's a psychologically safe space, it's confidential, and it's a collaborative effort between a clinician and the patient. And we need certain key skills to make this happen. Today, the topic is not about clinical knowledge and technical expertise. I believe you're confident and competent in the clinical knowledge and technical expertise. Today, the focus is on the communication skills, the clinical communication skills that one needs in delivering effective medical consultation skills. Before we move on to medical consultation skills, I would like to highlight that there are certain key foundations upon which every medical consultation happens. Those three key foundations are respect, responsibility, and relationship. We need to learn to respect the other person, their views, their opinions, their beliefs, and their value system. And in a medical consultation, I would like to emphasize this point here. In every medical consultation, a clinician has got two responsibilities. One, to listen to the patient, and to speak in such a way that the other person understands you clearly, which is called listenability. So there are three foundations: respect, responsibility, and relationship. Two responsibilities: to listen and to speak in such a way that the other person understands you clearly. By listening and by speaking in such a way that the other person understands you, you are already en route in establishing a trustworthy relationship with the patient. Firstly, we need to recognize that medical consultation is a key clinical activity. We all do number of consultations in our professional career. I've read a few years ago that in UK there are over 1 million medical consultations in a day, and each doctor will conduct nearly 200,000 medical consultations in his or her professional career. And I strongly believe that number is much higher now with the advances in technology. So the other important thing to acknowledge here is medical consultation is not just about diagnosis and management. It's the meeting between two humans, two experts. Patient is an expert in knowing what is happening and how the illness is affecting him or her, and the doctor is an expert in clinical knowledge. It's also meeting between two ecosystems, two belief systems, two value systems, and two agendas. So one should be aware that it's a dialogue and it's a collaborative effort between a doctor and a patient. So there are three key stages to the medical consultation. The best analogy I could think of is like making a movie. There's pre-production, production, and post-production work. Similarly, there's a pre-consultation, consultation, and post-consultation. In the pre-consultation, which doesn't last long because we all have got number of patients to see, it lasts only few seconds up to a minute. But I suggest you take a minute between patients. It helps you to recover and it also helps you to plan ahead. For example, if you want to take or make any important call, you could do that. It's important to make sure that you are ready for the next consultation by reading the relevant medical notes and, if necessary, to refreshing your knowledge about the test results. So as I said, it usually doesn't take long, but it's very important to be mindful of what stage your mind, like where your mind is at, and you should be ready for your next patient. The consultation stage, this is the key part. As you know, it can last from 8 to 15 minutes, but on average it's about 8 minutes. So this is where this is the meat of the consultation. This is where you ask questions, you listen to the patient, you establish a diagnosis, you examine the patient, and you tell them the management plan. So this is where all the action happens. And the last but very important aspect of the medical consultation is what you do after patient leaves the room. The coding is very important if you're working in a healthcare setting like UK, and documentation is very important. It's very important that you finish off the notes before you are ready for the next patient, and if there are any important follow-up arrangements or tests to be requested, this is where you complete those tasks. Some people do it immediately after the medical consultation, and some people do it after they finish the clinic. You can decide which works best for you, but I strongly suggest that you complete the key task as soon as you complete the middle part of the medical consultation, or as soon as the patient leaves the room. So that's about our first topic of the session, about what is medical consultation. Now moving on to communication equation itself and the importance of listening in medical consultation. Communication, the way I see it, is about what you say, how you say, when you stop, and how you be in the consultation. So it has got these 5 components. I repeat: what you say, when you say, how you say, when you stop, and how you be. So as we all know, communication equals speaking and listening. That's the standard elements of those two, speaking and listening, are the standard elements of the communication. But what I would like to propose today is a new equation which would help us learn and practice and implement the medical consultation skills effectively. The equation which I'm going to propose today is medical consultation equals listening plus listenability. So you listen first to understand what the patient is saying, and then use all the information effectively in speaking in such a way that the other person understands you clearly. I'll go through these two elements of the equation in much more detail. So, a few lines about listenability. As I said earlier, it's speaking in such a way that you take into consideration the other person's beliefs, opinions, values, and his take on his illness, and speak in such a way, speak avoiding any medical jargon. Try and use lay person's language. In some countries where you study in English and practice in a local language, and where you work in a community where people speak different languages, this can be a challenging prospect. But try and learn to speak in a lay person language. And this helps you to explain things clearly, and also enables you to check understanding of the like what patient understood, and clarifying where needed. Listening. Now moving on to the importance of listening in medical consultation. Listening, I think, as you will see in this image, that listening is the keystone of medical consultation or any clinical communication activity. I think without listening, the bridge will collapse. And what I mean by that is, without effective listening, communication can break down, and misunderstandings can happen, can lead to poor patient outcomes. So don't worry, I'm going to share with you some key evidence-based listening tips that are proposed by International Listening Association. But before we move on, I just want to make one thing very clear here, that the listening and hearing are two different things. I'm seeing, and I'm sure you have seen, that these two words are used interchangeably in conversations quite a lot. I just want to make it very clear that those two are different. Hearing is a component of listening. It's one of the five senses, as you know. It involves sound waves striking the eardrum and causing vibrations that are sent to the brain. But listening is totally different, and hearing is a component of listening, and listening, as defined by International Listening Association, is a process of receiving, constructing meaning from, and responding to spoken and or non-verbal messages. So it involves three equally important components, that is receiving, constructing meaning from verbal and non-verbal messages, and responding appropriately. The other way of putting listening is looking at it as a multi-dimensional construct. There are three components to the listening act. It's very easy to remember, goes by A, B, and C. It's affective, how you feel about listening; behavioral, what you do when you're listening; and cognitive, which involves how you process the information. These components of listening, and by listening effectively, one can establish humane connections with the patient, the family, the community, and team members. So I repeat, listening is different from hearing. Listening is a process of receiving, constructing meaning from, and responding to verbal and non-verbal messages. And it has got three components: affective, behavioral, and cognitive. What we know from research about listening, we know that it is not a hard-wired trait. It is a habit. It is a cognitive function that is perceived behaviorally. It is a function of a habit. We all have our own conditioned habits with which we listen to and from. They may be influenced by environmental, cultural, and maybe by the role which you are playing. But good news is that one can shift the listening habits. One can learn new habits and drop the habits that are not effective. So listening is a cognitive function, and it's a measurable habit, and one can consciously shift their habits based on the needs of the person with whom you're having conversation with, and depending on the context. Now, moving on to the listening tips. The International Listening Association, also I'm going to use ILA from here onwards. The ILA has come up with 10 listening tips. These are proven and effective tips, which if you could use and people who have used them benefited quite a lot, and I'm sure and I'm confident that you benefit from them too. I'm certainly benefiting from them in my personal and professional life. Number 1, value listening. Consciously choose to listen more and listen better. That's what we talked about. We need to see it as a key component of medical consultation. As I've emphasized, it forms 50% of the communication equation. So we need to start giving the credit it deserves, and we need to value its significance more. Now, number 2, listen with an open mind to what the speaker has to say. Remember earlier I said medical consultation is meeting between two values, two opinions, two beliefs, two agendas, and two perspectives. Listening with an open mind involves welcoming the other person's beliefs, perspectives, and opinions. So it can be challenging at times, but listening with an open mind enables you to establish the trust and rapport quite early on in the medical consultation. Number 3 is very important tip: prepare to listen. Here you should be aware of the barriers to listening, which I call them as listening thieves. The thieves that are out there that are robbing your capacity to listen. Be aware of those thieves and try and negate them. I'm going to give you some tips on how you can do that. Number 4, which you might have heard this many times before, let the speaker finish talking before you respond. I can't emphasize how important this is. And this comes up again and again from patients' surveys that the doctor did not let me finish what I have to say. Yes, we are all working in a challenging healthcare setting where time has become a significant commodity. But what is also important is we make time for the patients to finish what they have to say, because it is very crucial in making the diagnosis. Number 5, look for both verbal and non-verbal clues about how important this message is to this patient or speaker. As you know, there may be a lot of emotions involved in a medical consultation. Patients may be emotional, may be stressful and upset and unhappy that they're feeling unwell. And when one is sharing information which involves emotional component, it is understood that only 7% of the conversation includes the words. The rest, 92%, is expressed in the way of the body language, feelings, and the gestures which they use, and the tone of how they're telling you. So it's very important to pay attention to the tone and the body language and the emotions with which the patient is sharing their story. Number 7, very important in the current global healthcare perspective, because we are all moving to different countries. People are migrating to different countries. There's a lot of professional migration. So like if you take, for example, UK, we practice and work in a multicultural society. So it is very important to acknowledge the cultural differences. Not only cultural differences, one should acknowledge the age differences and gender differences. So be aware of cultural differences, age differences, and gender differences in how people speak to each other and how they listen to each other. They may be expecting different indicators of listening and respect. Take a moment here and ask yourself, how is listening different from your culture to, if you are working in a different culture, how is listening different from your culture to other culture, and how people listen and what is expected in your culture. So being aware of that gives you some insights into cultural differences. Number 8, again, you might have heard and read about it quite a lot. First, listen to understand, not to respond. Yes, I can't emphasize how important this is. By asking right questions, by summarizing what patient has said so far in the medical consultation, by clarifying the meaning of certain words, especially the medical words which the patients use in the consultation, you can get the true meaning of what the patient is saying, and that will help you to understand the patient better. Reflect back what you have heard if it seems appropriate. Again, you don't necessarily have to do it every time, but it does help in maintaining the relationship or connection with the patient during a medical consultation. The one thing that will help when you're reflecting is try and speak the same language what the patient is using. If the patient says, I'm not feeling well, or I feel this way, try and reflect back with the statement that includes the feeling element. I'm sorry that you're not feeling well. You could use that, you could say that. Finally, number 10, respond in a way that shows that you have listened and follow up with future actions to show that you've listened. So these are the 10 listening tips which you could use in a medical consultation, and I'm confident that they will help you in conducting an effective medical consultation.